I was shocked, worried. I think it was stage 1, which is very early. So I knew that that would probably give me a good chance.
We could diagnose cancers, but not always treat them. And there's nothing worse than providing a diagnosis without offering hope.
Considering what my father went through and what I went through, there was a huge difference. I was so much more blessed.
You are changing people's lives, and they're getting more time to do what they want to do, spend time with family. And as a doctor, that's just a brilliant outcome.
Billions of people around the world struggle to access the healthcare they need. But we are not bound by the circumstances we inherit. Together with healthcare leaders and governments, we can help people live longer, healthier lives, regardless of their location or income. By combining our efforts, we are working towards a world without fear of cancer, a future where early diagnosis, comprehensive care delivery, and robust training and education are within reach for all. Today we invite you to meet some of the remarkable leaders and courageous patients lighting the way forward. Welcome to our latest Shape 25 Spotlight.
Manchester has always been an industrial city. It's shaped the health issues we see today. Lung cancer remains responsible for over 35,000 deaths per year in the UK and is the leading cause of cancer death. The urgency to change this is very clear, and we knew that early detection saves lives. So in 2016, we created a pragmatic but evidence-based program to reach at-risk groups through innovation and community engagement. We set these mobile clinics up in community centres and football stadiums, away from hospitals which we know patients regard as scary. And to make it even less scary, we called them lung health checks.
I started smoking when I was about 13, 14. I used to steal my parents' cigarettes on the way to school. The letter, the invitation, arrived in December 2021. And initially I just threw it to one side because I was too busy with my job. And what happened was I had a late cancellation, and I thought, oh, I might as well go for the screening. Walked in, registered, a young nurse did my weight, my height, and she asked me to go through the scanner.
Patient experience really matters. These trailers were designed for patient comfort, to be less scary, and to maximise our throughput so we had a real impact on community outcomes. The one-stop model with immediate access to CT scanning means that everybody benefits and nobody drops out that can benefit from the programme.
So when we went to see Dr. Booton about the results, we sat down, he had it on the screen, he pointed to a certain area in my lung and said, I'm pretty certain that that is cancer. I was shocked, worried. Yeah, everything went through my mind.
Responsibility drives us, and to date we've completed over 100,000 assessments. We're seeing 80% of cancers detected early at stage 1 and 2, and over 80% being radically treatable with the intent of cure. And since 2016, we've now seen a 25% reduction in stage 4 disease, really driving home the benefit of early diagnosis.
The surgery went well. Getting the news that it was all clear was probably one of the best days of my life.
Our regional success has now scaled nationwide, and now the countrywide NHS lung cancer screening programme expects to invite over 6 million people by 2029. And that, of course, is a massive achievement and will have tremendous results. We're creating a world where patients can not be fearful of this dreadful disease.
10 years ago, public cancer care in Brazil was insufficient. Only 60% had access to treatment. There were large gaps between public and private care, with long waiting lists.
Our personality, our way of how we are facing cancer is what makes the difference. So, before cancer, my life was already like this. I'm a happy person. I really like to serve people. When I was diagnosed with cancer, it was a surprise. So, at first, it was a very big impact. The ground shifted beneath me. Because my father died of esophageal cancer. It reminded me of everything we went through back then, my father's suffering. That was the day that I cried.
To build comprehensive oncological care that serves everyone, the Brazilian Ministry of Health initiated the PERSIS project in 2012. By the end of 2025, 92 linear accelerators will be installed throughout the country, expanding treatment capacity to more than 55,000 new patients every year in 27 states, some previously without access to technology.
When I got here, the girls calmed me down. I entered the room, and it was very calm. The marking was something so discreet. And then I cried again. This time it was joy. Once I let go of the fear that radiation therapy would be harsh on my body. When the time came, on the contrary, I realized that the whole procedure felt surprisingly smooth and easy, thank God.
Radiotherapy used to take up to 35 sessions, meaning almost 7 weeks in Fortaleza. Many patients needed to travel long distances to receive care. Many patients were unable to make their trips and lost the treatment. So we needed to rethink how radiotherapy was being done. We started hypofractionation protocols that were only possible thanks to technological innovations and to the PERSIS device. With this, we reduced the number of sessions, allowing patients to stay less time in Fortaleza and helping us achieve an increase of almost 30% more patients treated. For patients, the impact is transformative. Some breast cancer treatments dropped from 25 sessions to just 5. And on average, treatments went from 36 to 18 sessions. Treatment time has also improved. Urgent cases are treated within a week.
Everything changed. Everything. If you see what my father went through and what I went through, there was a huge difference. I was so much more blessed.
Our purpose is clear. We want to get quality cancer care to the people who need it, regardless of who they are or where they live. From the UK to Brazil, the voices in this video show how scaling up access changes people's lives. And we want to do more. Our goal is to achieve 3.3 billion patient touchpoints by 2030. We'll do that by focusing on early diagnosis, comprehensive care, and training and education. Mobile mammography systems and PET-CT systems help provide care in remote areas. Enhancing education for healthcare workers locally helps them fight cancer. To personalize and redefine advanced radiotherapies, we're harnessing the power of AI. We do this all with a clear focus to democratize healthcare and make treatment more accessible.
This success story belongs to our patients, regardless of social class. Everyone receives the high-quality oncological treatment they deserve.
If you get the invitation, make sure that you go to the screening. It could save your life, it could prolong your life.
Don't take no for an answer. Make sure that you implement this in the right way. The rewards are amazing.
Thank you very much for this network of love that we find. This is what makes us win, because alone we will not win.